Okay, Yersinia pseudotuberculosis, not very common disease, not very fatal either. Not as I said, most important one is was the Yersinia pestis in that these groups of organisms. This like other pathogens, but the others, when it says animal pathogen, of course, is zoonotic, but therefore others were animal pathogens as well. But it is, more prevalent, this one is in animals. Infects wild and domestic animals, both of them. Causes necrotic lesions in the liver, spleen, and lymph nodes. Infection via oral route from infected animal fecal material. So it's orophecal transmission it has. If you suspect an animal to be sick and it is endemic in the area, you have to be careful there. Symptoms, abdominal pain, diarrhea, since it is orophecal, it can mimic appendicitis, and also because of the necrosis it causes as well. Swollen lymph nodes, fever, and rarely invades bloodstream. So the bacteremia is not very common with this one, not as common as Yersinia pestis. It may cause arthritis. Remember Dr. Fox made the point of certain Yersinia, okay, and also the Shigella. Those are the organisms he mentioned that can lead to arthritis and also other inflammatory diseases. Yes, I would imagine it would be. I don't. Okay, let me tell you this. Reactive arthritis is when you can find the organism in the. That's septic arthritis. No, that's septic arthritis. Reactive is not, you don't find the organism. Sterile. Okay, ampicillin, streptomycin, or tetracycline is the treatment, easily treated. Enterocolytica. Did Dr. Fox cover that? Enterocolytica, mostly in Sweden, in icy, snowy places. Okay, I'll just go over very, very quickly since it's up there. All right, he normally does cover that under Enterobacteriaceae. Isolated from rodents, farm animals, cats and dogs. Humans acquire infection via orophycal route, just like the pseudotuberculosis. Most common in Scandinavia and Western Europe. Some parts of Canada and northern parts, there have been some cases. Okay. The symptoms are abdominal pain, diarrhea. Is not invasive. This can also mimic appendicitis just by virtue of infecting. Swollen lymph nodes and fever. Okay, and it can develop, lead to severe arthritis, especially in people who have got HLA-B27 MHC. If you remember when I was talking about MHC, B27 was one of the baddies. DR3B27. Those two were baddies. Okay, diagnosis, isolation of organisms from feces, blood, or lymph node. The organism will grow at colder temperatures. This is the organism that Dr. Fox said, cold enrichment. You put something in the refrigerator and it will still grow. Treatment for septicemia, gentamicin or chloramphenicol, and for enteritis, enteritis is usually self-limiting and it does not have to be treated until the patient becomes septicemic. Okay, so that was the first part of zoonosis.